Hi, my name is Taylor with Valor Medical Solutions, and today I'm going to be showing you how to use the ROMTech Portable Connect. This was probably prescribed to you by your orthopedic surgeon after your lower extremity surgery. This is going to help with rehabilitating and getting you back on track in life. You want to be sitting straight up in front of the PC where the screen is going to be facing you and your feet will be in the pedals. There's going to be a heel cuff at the bottom to help you keep your foot in place and keep it where it needs to be. When starting the bike, you are going to have your patient ID that should have already been signed in for you. This is going to be specific to you and it's going to follow you through your progress. And as your treatment plan goes on, you're going to watch it gradually get harder and a little bit more challenging. When you're ready to begin, all you're going to do is press start. When starting, you're going to get this initialization and process screen. And once your bike has fully loaded, you're going to come on and you're going to see your treatment plan. Your treatment plan is going to be specific to you. There are different treatment plans for a hip surgery and for a knee surgery, and these are going to be run through by your orthopedic surgeon and approved by them as well. On here, you're going to have your orthopedic surgeon's name and information, and then you will also have your treatment plan. Most of the time, it's going to consist of passive and active motion. Passive being the passive range of motion where the bike is going to do all the work for you. Active is going to be where you are going to actively pedal yourself. Most of the time, you're going to start out at 10 minutes of that passive and 2 minutes of the active. And then your session duration will always be contingent on how long that passive and active motion is. You're going to have your sessions per day, which will usually be 5. Now, that doesn't mean you have to do 5, but you do have a maximum of 5 a day. You always want to make sure that you're taking an ample amount of time in between each session, so that way you're not overdoing it. When you're ready to get started and you feel situated, you're going to press next. The bike is going to adjust to help you keep the leg that you're getting operated on in place. When you begin, you're going to be asked a couple of questions. These are standard questions that you will most likely see at the beginning of each treatment plan in each session. Your first question is going to be about pain level. If you put anything higher than 8, your orthopedic surgeon will be notified and you most likely will be getting a call. If you're feeling like you're more than an 8, it is probably best that you stay off and give yourself ample amount of time before getting back on. But you'll go ahead and press the number of what you're feeling. Then you'll go ahead and press next. This question's asking the last time you took your pain medication. Now, this is for the narcotic pain medication. This is not for your Tylenol. This is more for what has been prescribed to you. You're going to answer however that is, and then you'll press next. The bike is going to ask you to put your feet in the pedals. When you put your feet in the pedals, you want to make sure that your foot is all the way down into the heel cuff and that your leg is situated and bent at about a 45 to a 25 degree angle. And when you feel comfortable and you're ready to start, you'll hit the white circle that your feet are in the pedals. And when you're ready to go, you'll press next. The bike is going to count down for you. And when you're ready to start, the pedals are going to start to gradually move at a very slow pace. Your bike will never go any faster than the pace that it's going currently. When you start your session, you're going to see this screen every time that you start. At the end of your recovery, the goal is trying to have an extension of 0 degrees and flexion of 120 degrees. As you press increase on the bike, the pedals are actually going to move outward to help you achieve that goal. At the beginning of your session, we'd like you to stay at a place that you feel comfortable and relaxed. We do not want this to be something that's going to be challenging and too hard. The goal is to gain that mobility back, not to discourage you. But when you're ready to start, you want to make sure when you see this screen and you feel comfortable that you press stay. If you do not press stay, your timer will not start. Once you press stay, your timer is triggered to start, which allows the bike to know that you're ready to start your session. When using the PC, you want to make sure during this passive motion that you're letting the PC do the work. If you push against the pedals, the bike is going to give you some resistance. So remember, relax, take a deep breath, and let the PC do the work for you. While in this function, if you would like to change your pedal position, you can at any point in time by pressing the pedal icon here at the top right. Will take you back to that screen that we saw at the beginning. If you wanted to increase, like I said, you just press increase, which moves the pedals further out. If you did that and it was feeling like it was a little too challenging for you, you can always go back in and simply decrease it. But just remember, when you're ready and you're comfortable where you are, to always press stay. That allows the bike to know that you're ready and your timer begins. Couple of other things here on the screen that you would need to know is your pedal position will always be shown to you up here at the top left. I did increase it so that way we could see how that looked. So right now the pedal position is 2 out of 6. 6 being the highest and 1 being the lowest, which you will always start out at 1. If you ever need to stop or pause your session, make sure to hit the X or the stop sign at the top right and left corners. When you press this, you'll have an option to end your session or continue off where you left off. The screen will always remind you to relax and not push against the pedals. However, it doesn't mean you are, it's just reminding you not to. And at this portion, you just want to make sure you're trying your hardest to relax and let the PC do the work for you. This is to indicate how you're feeling towards the end of your session. Sometimes your pain level will go down, and that's due to breaking up scar tissue and having some relief in that knee. If that's the case, then that's normal. Do not worry. If you're feeling a little bit more pain, take some time off, ice, and relax. You want to answer however it is, and then you'll press next. The bike is going to have you take your feet out of the pedals. You want to start with the leg that you did not get operated on, and then go ahead and help assist take the other one out. When you feel comfortable and your feet are on the ground, you'll press next. The bike is going to give you a graph of your ending pain level. I think this is a great reference for patients to see how you're doing throughout your recovery process. It's a good reference to make sure you keep an eye on how that pain progress is going. At the end, you're going to have your exit screen. If you had any issues during your session, please let Valor know. You should be given a card with our number on it. You can also reach out to ROMTech themselves if it is after hours or on the weekend. That number will always be on your PC at the bottom of the screen. When you're finished, you'll go ahead and press exit, and you should come back to your welcome start screen. When you are ready to do another session, what you'll do is just go ahead and press start, and it starts all over from the beginning. When using the PC, there are a couple key points to keep in mind on how to use it. Up here at the top of your screen, there will be 3 buttons. The one to the far left is for the screen. If you press the button once, the screen will shut off. To turn it back on, you'll press it down one more time. The other 2 buttons over to the right are going to be your volume buttons. If you would like to turn your volume on, there will be a speaker icon to the right. Make sure that the line is not going through, and you can adjust those volume buttons up here at the top. If you do not want your volume on, make sure that the line is going through the speaker and that your volume is all the way down. If you are having issues with getting your bike started, or you're having any kind of error screen, you can always reset the bike. You do this by holding down the far right and the far left buttons. If you hold these down together, you're going to get an option on your screen to either power the PC off or restart. If you're having an issue, it is most likely going to be resolved by restarting the PC. If you, for any reason, end up hitting this emergency stop button, you'll notice that your green light on the switch shuts off. If this light is off and you press the start button, you are going to encounter an error, which is going to stop you from being able to start your session. If this does occur, you're going to come to a screen that's going to give you an error. It's going to ask you to make sure that the green light is on. If it is off, it is most likely due to the emergency stop button being hit. To resolve this issue, you'll just turn the red knob over to the right, and then to come out of the screen, you'll press the X at the top right, and you'll come right back to your start screen. The only other reason this light would be off is it was unplugged. If you're still running into any errors, please give us a call at Valor, or you can always reach out to ROMTech themselves. We would love to help you in any way that we can, and if you have an issue or you need something changed, we're here to help. Depending on your insurance coverage, you will have the PC for 3 to 6 weeks. If you are a Medicare patient, Medicare requires that you start the PC within 48 hours after your surgery. If for some reason you are failing to comply to these Medicare guidelines, we will need to know, and if we are not reached out to and we do not know the reason why, there will be a restocking fee. So if you have any questions regarding this guideline or any issues starting, please feel free to reach out to us and let us know. You can contact us over the phone or over text message as well. We hope you have a wonderful and quick recovery, and we wish you the best.